Occasionally, pulmonary branch stenosis is associated with other anomalies, particularly tubular hypoplasia of the ascending aorta. In the top and bottom left images, we can detect branch stenosis of the pulmonary arteries with slight post-stenotic dilatation. In the bottom right, we see an aortogram that reveals tubular hypoplasia of the ascending aorta. Note that the ascending aorta is smaller than the descending, which is opposite to what one should expect in a normal individual. This patient had mental retardation, abnormal facies, and the case was classified as Williams syndrome, or the arteriohepatic dysplasia of Watson. CT and MR studies can reveal the tubular hypoplasia of the ascending aorta. This is an oblique MR study which reveals the hypoplastic ascending aorta in a patient with Williams syndrome. Electronic reconstruction using CT or MR can reveal the tubular hypoplasia of the ascending aorta, seen in this other case with. This is the simian hand deformity with posterior origin of the thumb, which is one of the anomalies that can be seen in patients with the Williams syndrome. This is a syndrome also called arteriohepatic dysplasia because of the dysplastic biliary tree that is associated with the pulmonary branch stenosis. It has been also called the arteriohepatic dysplasia of Watson and Miller. The heart and lungs have anomalies such as ventricular septal defect, pulmonary stenosis, and peripheral pulmonary stenosis, as previously described in our first case. The patient may present with the jaundice, which is due to cholestasis. The patient has bile thrombi and paucity of the intrahepatic biliary radicals. Cholestasis may improve with age. There is no evidence of hepatic cirrhosis, failure, or portal hypertension. Other anomalies described in the arteriohepatic dysplasia of Watson and Miller are in the eyes. There is a pathognomonic sign that has been called the posterior embryotoxin, which is the prominent Schwab's line. The iris shows also abnormalities as well as the retina, and the patient may have strabismus. In the bones, we can see frank or incomplete butterfly vertebrae, decrease in the interpedicular distance in the lumbar spine, as often seen with acromegalics, lack of the progression of the increase of the interpedicular distance in the lumbar spine as well. We may observe the pointed anterior process of C1. There can be shortening of distal phalanges, stiffening, swelling, and limitation of motion of the proximal joints without pain or other joint involvement, and osteo and foreshortening of the. These patients may have a small face, a broad forehead, a small pointed mandible, and a flattened malar eminence. The central nervous system abnormalities include mental retardation, usually mild areflexia, gait disturbance, and cerebral dysfunction. In the kidneys, it is not uncommon to see nephrolithiasis or even nephrocalcinosis. The patient may have renal failure. And finally, the endocrine organs may be involved, such as primary hypothyroidism and a eunuchoid appearance. The voice of these patients may be hoarse.